Well, we are going to talk today about developing critical thinking and clinical judgment. And this is part of the HRSA grant through the Case Western Reserve School of Nursing. So the topic of critical thinking and clinical judgment kind of sounds like those two elements are very, very similar, and they are, and we're going to show you how they blend together. And my most important emphasis on this is how in the clinical setting it is so important to work on developing critical thinking and clinical judgment. And so this presentation and conversation does have continuing education with it. It has 0.5 contact hours for participation today. We'll follow the same process we have with the previous ones, which is just an email back and forth to receive the certificate. So first of all, a couple of really quick and general definitions. So there are full textbooks, multiple textbooks on developing critical thinking. And it is such an important topic in our world nowadays that now we have grade school children working on critical thinking exercises. So this is not just a nursing thing. It's actually a very broad cultural deficit that was identified. So the definition of critical thinking is reasonable, reflective thinking that focuses on what to believe or what to do. That's a general definition, not specific to any one aspect of it. And then in healthcare, and specifically in nursing, when we apply that, when we take that to the next level of thinking, it becomes clinical reasoning. And clinical reasoning is kind of defined as critical thinking in the context of the patient data and the clinical outcomes. So those are just kind of the background definitions that we're going to think about as we walk through a few slides today. And this is a really busy slide and you will not be tested on this, I promise. So I want you to see that the thinking process is massive and they've outlined it and it has lots of inputs and lots of areas. And what we're focusing on the development of is one aspect in the middle of it, critical thinking, which can be taught and it's a learned skill. And then that moves into clinical reasoning, which is that application of the patient data. And so that's where then you start to get into diagnostic thoughts and therapeutic thoughts. And this is all about thinking. It's really not about application or what you come away with. It's about the thinking. So a little abstract, but I'm going to see if we can make it more concrete for you. So critical thinking, I've abbreviated it as CT in a lot of the slides. Critical thinking is a set of skills, and that's why we are confident in the world of education today that we can teach this. So the first thing in critical thinking skills is to identify and validate assumptions. And I have a really quick example of this. My husband picked up a couple of nails and tires this week. His car alert system told him he had a tire that was going low. He quickly got out, looked at the tire, saw a nail, and assumed it was that tire that had the issue. Lo and behold, it was the second one that had the real flat issue. So even when something appears obvious, try in critical thinking skills to always validate that assumption. The second one would be to recognize inconsistencies and patterns and cluster related information. When people start to develop that ability, it helps support the critical thinking aspects. And then when you start to identify the inconsistencies, you're actually looking for that missing information. And that's real important when you see patterns and you identify what's missing, because that's where you need to focus attention. The next skill then would be to identify several conclusions, how could the situation go? What else could happen here? And then within all of that, you're looking at priorities. And the last one is kind of my favorite because I really like this thing called thinking, and that's to evaluate and correct our thinking. And so as we go through today, I think you'll see where that one pops up several times. That's a really critical aspect, also called reflection. So there are some strategies for critical thinking development, and as preceptors and as educators, it's really important for us to help develop these skills within ourselves so we model them, and with our learners who are attached at the hip and elbow to elbow with us. So these strategies include anticipating the questions that others might ask. And so that's all a thought process, except we can, especially as preceptors and teachers, we can think out loud. and help them anticipate what questions they might be asked by that patient, by that family, by that doctor. And then one of the types of questions, and I know last week we focused on questions because they're such an important educational tool. But in developing critical thinking, we want to especially ask the what else questions and what if questions. What else could we do? What else do we know about this? What else do we need to know about this? What if we did it this way? What if we do it another way? What if she has a reaction like this? So all the what else and what if questions to place in that learner's mind so that when they approach the situation, they don't have tunnel vision. We think aloud, we ask them to think aloud. The reason for that is because thinking aloud lets your brain hear it another way, and that's another way to think. Also, writing down having the person write down their thoughts, because when we see the information, it allows our brain to think about it in a different way. Really, these are all strategies to teach our thought processes, to retrain our brains to think broadly instead of narrowly. And then comparing and contrasting is a really neat exercise to do in the clinical setting, especially. Compare the schedule today with the schedule yesterday. Contrast the patient today with a diagnosis to the one we saw last week with the same diagnosis. What's the same and what's different? Again, that teaches people just to think outside of the box. That's really what critical thinking development is about. And so when you look at building critical thinking, you're actually dividing it into 4 different constructs of problem recognition, clinical support receptors, super important. Thinking about prioritization, and then thinking about thinking, which is reflection. So we're going to quickly go through those, and then I'm hopefully going to get your input on some ways to apply this. So problem recognition means that the person has the ability to anticipate likely problems. That's that what else and what if kind of questions we were talking about. And they have the ability to recognize the signs or signs and symptoms of a patient of an emerging problem. So they're seeing the abnormal patterns like we talked about on the other slide. There's the ability to clearly communicate real-time concerns about that emerging problem. And this is a key aspect that preceptors can help work on, because you're communicating all day and this puts a focus on it, and you're asking the learner to help verbalize what's about to happen. How is that problem unfolding? What do you see? What do you think we need to do? What else might work? It really helps them start to articulate that emerging problem. And again, when they talk out loud, the brain hears it differently and it spurs other types of thoughts. Then we look at the clinical decision making, and this is the ability to think of multiple solutions to a problem. So don't stop when you get to one thing that might work, but keep going because you don't know what's actually going to work. The ability to assess the strength of evidence for the different solutions you come up with. So this brings in the skills of evidence-based practice. Figuring out how to work with other experts to validate, remember the assumptions and validating assumptions. So this ability here brings in all those aspects of critical thinking. The ability to assess the applicability of those solutions to a particular situation or a patient need. So not just thinking about the solutions and not just figuring out whether there's evidence for the solution, but then to say, how would that solution look and feel for this patient, for this situation? So again, it's really taking someone down a thought process of making decisions mentally all the way along the process, and then adapting that care and that decision to different situations across different patient needs. Under prioritization, this is pretty basic, and I think that many adults come with this fairly well cemented, and that's the ability to sequence action steps. What is not necessarily well developed is the importance and the urgency that they need to look at. So there are some very important things we have to do with patients that aren't urgent. And then there's a sense of urgency about many items with patients or colleagues that aren't necessarily important in the long run. And sometimes differentiating those when you're having to prioritize a busy day is something that really learners kind of need to stop and have some guidance in thinking that through. Is this important? Is this urgent? And obviously when it's both, that is the top priority. And then the ability to decide what steps I don't have to do. Are there other colleagues? Are there other people on the team that I can delegate to or ask which of those steps are things that don't necessarily have to reside with me? And then do I have the ability to delegate appropriately? And of course, in the state of Ohio, there is an entire legal aspect of delegation decision-making tree that needs to be followed. And that is taught as part of the curriculums. And then one of my favorites is teaching through reflection. And so another way to think about reflection is to think about, what was I thinking? So reflection is a skill that develops critical thinking. It actually develops many, many different aspects of developing. But when you're thinking about teaching reflection or teaching critical thinking through reflection, you want someone to accurately recall a past experience and then to analyze mentally that past experience for the strengths and opportunities that they had in the experience or that the experience brought to them. And really what they're thinking about is, what were they thinking when that experience happened? So it's not just about the activity or the event that happened, it's how did they think and feel as that past experience was happening? Because that's where you start to get the really inner growth and the ability to do the last one on here, which is to apply that learning then into the current practice or the current steps, the current actions are doing. So reflection takes a couple minutes, it takes a little bit of time, it takes a little bit of conversation. But out of all these tools, reflection is probably the most important, tied very closely with thinking out loud, but very, very important to development of critical thinking. So with all of that kind of as a baseline of critical thinking, I thought it might be interesting to kind of talk out loud as a group then about how preceptors can help overcome the barriers that exist to developing critical thinking. And I've listed some of the barriers here. And I've kind of done the first one just on the words on the slide to help you see what I mean about how preceptors can help overcome these barriers. So one of the barriers with everything we've talked about is choosing only one solution. Thinking by the time we get to the solution, that's it, right? I'm done, I've got the solution, let's move forward, let's implement it, we're done. So as a preceptor, really easy to interrupt that barrier would just be to say, so are there other options we can consider? After somebody talks about the other options, then it would be, so can we do both? Do we have to only pick one or the other? Is there a way to use both of these solutions? So those are just mental processes to overcome a barrier of choosing only one solution. So another barrier is speed. We all work in a very fast-paced environment. And sometimes when you're going really fast, it's hard to slow down and think. In fact, a lot of people will chuckle and say, I didn't even have time to think today. Well, if we don't have time to think and we're the professionals, the learners are even more encumbered by that aspect. So what techniques, how can a preceptor help that barrier? What can we do so the learner isn't necessarily impacted by that fast-paced environment and can actually use some of these tools to develop thinking? What do you think? Got any thoughts?
Speed definitely can be an issue because sometimes if there's a lot going on, it is hard to make yourself slow down. Because I do realize we got to make sure that she's actually catching what's happening. So I do try, but I can see that can be a challenge sometimes.
So one of the techniques that I've used in the past with learners, I can't slow down. Now this is coming from a floor nurse perspective, but my guess is it's no different in a primary care. But I can't slow down, but then I've kind of become accustomed to that pace when I'm on the floor and I'm working. But my learner doesn't have to stay right with me all the time. It's okay for me to step away from her for 2.5 minutes to do another task and allow her 2.5 minutes to think about what just happened in the previous room. So when I come back, we can talk about it. Because I can leave her mentally where we just left. I can transition to the next location and come back because I've developed that part of the thinking. As a learner, she's not yet. And so sometimes it's okay to not keep them with you as you speed every activity. So another barrier is our focus on task completion. And every role in healthcare has certain tasks they have to do. And we all know we have our to-do list and these things have to be done by 8:40 every morning. And this set of tasks have to be done by 9:30 every morning. how does that task completion, how do we overcome that? Because we don't want people just focusing on tasks. They have to think about the tasks. Is there something we can do there that will help learners overcome that barrier?
I like to do the conversational piece of it, like talk about it after, like, okay, this is what we did. What is the outcome here? You know, what, that kind of thing.
Good, good. That's a good idea.
I think if it's an everyday task, like if it's a report you have to do every morning, you can tell the student what the background of the report is. Why do we do this every morning at this time? Who else uses that information? Why is it important for patient care? I think if we give students the background of the task that we do consistently, that can also help them see the importance of getting it done, and why it has to be done at a certain time.
Absolutely. Gives them the theory behind it, gives them the mental part behind the physical part of the task. Absolutely.
Mm-hmm.
So this next one is an interesting one. And most of the areas that I read, most of the information call it mine is better. It's an egocentric approach perspective, and we all kind of think the world revolves around us at different times. And so I have an example. Years ago, I had a manager who came from a different organization and was my boss. And one of the favorite phrases that was used is, where I came from, we, and then would fill in the blank with whatever was appropriate. Meaning, I know how to do this better, let me tell you. So my idea is better than your idea is kind of what this is. And if a learner brings that perspective with them, if they are consistently coming from, you know, where I worked, we did this, or where I do work, or my last clinical, and they're always trying to kind of one up what they're seeing in your setting, that really is a very, very strong barrier to them learning and thinking critically about the environment. So have you experienced anything like that at any of the group listening to today? Have you experienced anything, any learner that kind of had that perspective?
Well, no, not so far. I suppose when I was training new nurses starting here, I'm sure I would have experienced that at some point. But Sabrina's been the first student I had, and she was definitely, she didn't bring anything like that.
Good, good, awesome. Well, it is, I mean, it is one of the things when you see that the person is pretty closed to thinking outside the box. And so that's when you really have to go back to some of those other strategies and help move them out of that box, because that's a definite indication that they're in a mindset that isn't going to grow right then. Some people are very resistant to change. They automatically reject new ideas and alternatives without examining them. So again, going back and helping somebody see that we need more than one solution, that we need to, you know, really confirm or validate assumptions, those kinds of things. That resistance to change is a real hard one, and anybody in a management position has definitely contended with that one. From a learner perspective, any insights there into how in a learning clinical setting like a primary care clinic setting we could help somebody overcome resistance to change?
Well, I mean, I told you before, when I'm teaching something, you know, offering new ideas, I do like to give the background. You know, this is where this idea came from. This is why I do feel this works best. I mean, it may not be the best thing for them, but I do like to give that insight as to where my ideas came from. You know what I mean?
Mm-hmm.
Yep.
Yeah.
Yeah. And that can help somebody overcome that hesitancy. Change is hard. And if I know one thing and now in this new setting, I'm trying to apply it in a different way, that is a kind of change. And so sometimes change can be, you know, fearful. I'm not sure I'm going to do it right. You know, I don't want to go down that path. So those are good ideas. So Becky, in the next one, conformity,
Mm-hmm.
I thought about some of the examples that you've given me of students that you've worked with where they really want to work together and they don't want to
Mm-hmm.
develop individual thought. And sometimes students really fall into this. Their lack of experience grows a lack of confidence. And so
Mm-hmm.
there's confidence in numbers. And people will either follow the group or follow an organization. Maybe it's just that they're going to follow that policy to the letter of the law, and they can't think past that. They can't see that new technology is emerging and changing how we do that and those types of things. Or sometimes it's just group security, meaning I want to have my fellow student with me. We're going to go down the hall and do this together instead of learning to manage those tasks independently. And of course, if they're not thinking independently, then they're not developing critical thinking. Right. So again, Becky, we've had a couple conversations. It made me think of some of the issues that you've had with students in the past. So how can preceptors or faculty, either one, kind of unbundle this conformity being a block, a barrier to critical thinking? What kind of strategies do you think we could use to get students, when they're in that type of pattern, to get them out, to help them see the other, past that box that they're in so comfortably?
I think the strategy I came up with, and it may not be the best, is just to put them in a separate space. So if they're in a separate space, they can't be together to be thinking or chatting. However, they do have cell phones. And so they can be having conversations or texting on cell phones too. So the separation by space isn't always, doesn't always get to where we want to be. The other thing I've used is assigning different tasks at the same time and then asking them to come back together to have a discussion about each one of those tasks or assignments. And they can be similar so that we can have a group conversation, or they can be different and say, tell the other person what you learned from that. And then that helps them also get that reflection piece in there too, as they're sharing with another person. So those are two of the things that I've used. I don't know if they're the most effective, but those are the two things I've used.
Well, actually, I love them. And I think your second one is pretty close to the primary one I've used when I've had this in the past is, when I say we need to get them to see more than one solution. And so I've taken those solutions and divided them among the group or between the two people, depending on who's conforming to each other, and asked them to explore those various solutions independently. And then, as you said, come back and compare notes, and to give them the security of, I'm not separating you forever. I just want you to think about this individually, and then we can share. So very similar thinking there, Becky. Thank you. And then I think, go ahead.
Oh, this is Mary. I wanted to share just another idea is if this is sort of their pattern, and it's not a bad pattern in some regards because it's collaboration, teamwork, but maybe to also task them to give each other feedback, because feedback is a huge problem that I find when I precept students, that when you give them feedback, they're very defensive and they feel very hurt. And we need to get our students to understand that giving and receiving feedback is a normal part of our work and has to be there in order to do our jobs, with safety in mind and with quality in mind. So just maybe turning it around a little bit and using their dyad behavior to strengthen a component that needs to be strengthened in our precepting.
Yeah, I love that idea. I think that would help with conformity. It also helps with the mine is better, that egocentric approach. And going way back to one of the first slides, that also is a great strategy to help teach them to validate assumptions, because that's what the other person's going to do through that feedback. They're either going to validate or negate the assumption that was the conclusion that was given. So excellent, excellent idea. And so the final one on here on this slide is stereotyping. And basically that's overgeneralization that's taken as truth. So all patients with this diagnosis automatically are this way, or all patients from this neighborhood are this way. And so really kind of breaking that mold, I had to kind of think a little bit about how important this is in today's world, especially because I think we have a lot of stereotyping that is getting challenged right now, which is a good thing in our culture and society. So I think that goes along with critical thinking, to actually think at the individual level instead of broad categorization. Any other comments on stereotyping or any other barriers on this slide? These are the things that prevent someone from developing and using, it goes on both sides of the coin, both developing and using critical thinking. Okay, So my final question is, how can we develop critical thinking specifically within the primary care setting? So these are very broad and general things we've talked about today, but things like episodic care, chronic care management, population health management, those provide very unique perspectives and very unique challenges that can play into the development of critical thinking. And so I just wanted to take a minute or two and see if we could pull out any specific elements within the primary care setting that could easily be applied and help student nurses both understand primary care and the roles and the responsibilities that the primary care provides within our healthcare setting, but any way that those then can be specifically used to develop critical thinking.
So last week, it unfortunately happened on Wednesday when Sabrina was not here. So I talked her just through a situation that took place with a patient, and things went unexpectedly. It was supposed to be a simple med rec, and as I was bringing him back, he was telling me he was feeling dizzy and he didn't feel right. History of some stuff with his heart. He also has he's diabetic. So I came to Sabrina with, this is what happened. This is what the patient said. What are we going to do first? And we just talked through the whole situation, how it played out, what the nurse's role was, what do we need to tell the doctor so that we can carry on with the next step. That I found that very helpful, because it made her think about her role, basically, because sometimes unexpected stuff does take place.
Yeah, that's great. I mean, you helped clarify the role, which is a wonderful outcome for a student in a primary care setting. You also helped her think out loud. You were thinking out loud and helping her think out loud. Again, really critical skill in development of of critical thinking. So love that example.
Thank you.
And truthfully, we could almost turn any patient encounter, I think is the right word, into a case study that way. Mm-hmm. What do we need to talk to so-and-so about? What do we need to do here? What's next? What should we be thinking about? So great example, Tanya.
Thank you.
Anything else on this? Ways that anybody on the call can think of that would highlight primary care and allow for development of critical thinking kind of in the same bucket of actions?
I do think using a reflective tool or a journal can be useful, especially when we do episodic care in primary care, so that they could maybe see how their thinking changes over time for a disease process, a group of people from a certain neighborhood or a certain age of people, how they respond to certain things. But I think if we could get them to reflect or write a couple of sentences about, how things went on that day, they can kind of go back and say, oh, I did have somebody that was similar to that. Or if we're seeing this patient weekly for a blood pressure check, they can write every week about how things are changing or what interventions might have been very useful to that specific patient over time, which is kind of a primary care issue, is we don't see them every day or 5 days in a row. We see them once every other week. And how do we change behaviors or help the patient change behaviors and move them where the patient wants to go? So.
Love that idea, Becky. That's not only reflective, which is amazing, and again, like I've said, one of my favorite tools, but it's also helping them compare and contrast and build patterns over time. So really that idea that you just had captures 3 or 4 of the strategies that we've talked about today and pulls them all into one. That's a great idea.